Good day everyone, I am Zoe Marie and guys, so for today's return demonstration, I will be performing to you the open gloving technique. So the first step that we need to do is we need to perform hand hygiene because this prevents the spread of microorganisms. Okay. Next, we need to check if our gloves are, if the outer package is dry and unopened. So it is unopened and it is dry because moisture can contaminate the package. And we also need to note for the expiration date. So it says here that it will expire on August 2025. So we need to take note of this because this indicates until when will the package remain sterile. So for the third step, we need to place the glove package here in the clean dry surface at or above the wrist. Because again, we want, because the moisture can contaminate the package and anything that is held below the waist is considered contaminated. Next, we need to open the glove by pulling the top layer back. And then remove the inner package, handling only the outside of it so that the inside remains sterile. Okay. Here, the size is 7.0, and then we need to place this inner package here in our dry working surface, and we need to ensure that the cuff end is closest to the nurse to allow for ease of glove application. In the next step, we need to carefully open the inner package. Okay, we need to open the inner package and expose the gloves. So we need to do it in a way that we need to touch fold the open top flap and then bottom and then sides. Okay. Whew. So be careful, take care not to touch the inner surface of the glove itself, because it is considered sterile and the outer 1-inch border is considered contaminated. Okay. So wait. Okay. So with the thumb and forefinger of the non-dominant hand, we need to grasp the folded cuff of the dominant hand. So my dominant hand is left because I'm a left-handed. And then this unsterile hand should only touch the exposed inside of it so that the outside remains sterile. Then we need to, keeping hands above the waistline, we need to lift the glove up and then with fingers down, and we need to be careful that it does not touch any unsterile areas to prevent the glove itself from being contaminated. And then next, we need to, now that it's lifted, we need to carefully insert our dominant hand, palm up. Wait. Then pull it. There. And then we need to keep the cuff folded, and then we can only expose it fully until the other hand is already gloved. So attempting to turn upward with unsterile hand may result in contamination of the sterile glove. So next, we need to hold our thumb outward because this prevents the thumb from being contaminated. And then we need to insert our fingers here inside the cuff of the non-dominant hand. And we need to be careful that it does not touch any unsterile areas of the inner package, because again, the outer 1-inch border is contaminated. And then next, we need to lift it and then insert our non-dominant hand in the glove. Again. Okay, and then we need to pull the cuff down, and then we can also insert our fingers here. Okay, and then sterile surface touching sterile surface prevents contamination. And then we can, now that we have both our gloves on, we can now adjust both of it. Okay. Okay, so now we are done. Donning our gloves. So the next step that I will teach you is how to remove the gloves. So we need to remove it. We need proper technique in removing this, so that we can again prevent the transmission of pathogens. We need to prevent the spread of microorganisms from the exposed glove to the skin surface. So we need to, in doing this, we need to use our dominant hand, which is my left hand, and we need to touch the exposed glove here in the cuff end, near the cuff end, and then invert it. We need to turn it inside out so that the contaminated area contaminated area is inside, and it does not, and we also need to avoid allowing the glove's outer surface to buckle inward against your wrist, so that the glove does not come in contact with the skin. Okay, so we need to pull it. Okay, and then we need to put our gloves here in our dominant hand, and then we need to remove the glove here by sliding our 2 fingers between the cuff and the wrist, and then pull it again, and then pull it again, so that the exposed area of the glove is inside, and then this glove is now enveloping the other glove that we removed earlier. So we do this so that the contaminated area does not come in contact with the skin, with the hand or the wrist. So now that it is done, we need to dispose it properly. Okay. So we need to do this to prevent the transmission of infection. Okay. And then we need to perform hand hygiene to prevent the spread of microorganisms. Thank you for listening.